name is Nguyen. Today we'll talk about lung cancer. So lung cancer is the the highest death rate in America compared to any other type of cancer. In 2012, it took away more than 1,500,000 lives. The data were given by the CDC.gov, a government office that is also known as the Center for Disease Control and Prevention, last updated in September 2nd, 2014. People around us are slowly affected by this disease because of the smokers and our ignorance toward the environment that we lived in. As a part of the community, we must know about the severe disease in order for us to prevent from getting it. So I'm grateful to talk about this topic because I learned it about the lung cancer as I take about microbiology in high school, and I did research about it. Learning about lung cancer would give us a better understanding about the disease and teach us what to do in order to reduce our risk of getting it, and also to maintain a healthier lifestyle. So first, I would define lung cancer and the risk factor, then I will talk about the symptom and the treatment, and lastly, I will discuss with you all about prevention method. So first, let's start by defining lung cancer. So what is lung cancer? Lung cancer is when abnormal cells undergo the cell cycles in which they grow out of control, and when the cells grow in the lung, it's called primary lung cancer. And primary lung cancer have two types, which is a non-small cell, which is the common one and less severe compared to the small cell lung cancer, which is rare and more severe. So according to Ruth Holstock, a medical doctor who's an expert in his field about cancer, in November 5th, 2010, practice nurse, small cell lung cancer is more aggressive and spread faster compared to the non-small cells. So let's go over to the cause. So there is 5 known factors of lung cancer. According to Nursing Standard, published by Royal College of Nursing Institution in January 22nd, 2014. Smoking is the main cause of 9 out of 10 cases of lung cancer. Besides, StateByCancer.org, a website of American Cancer Society, last assessed November 13, 2015. Secondhand smoke is also the cause. Secondhand smoke is when a person involuntarily inhale in the smoke that is smoked by others. It also can cause the same harmful to your lung as smoking. The second cause is radon. Radon is a natural gas that can be found in rocks and old building structures. And this, according to the EPA.gov, a website of United States Environmental Protection, last updated in October 22nd, 2015. Radon is the first cause among non-smokers. And other substances including asbestos, arsenic, some form of silica, and chromium that can be found at workplace also cause lung cancer. The third factor is genetic. So if a person has a family member that have lung cancer, there is more likely that that person also have lung cancer. And the last factor is radiant therapy. So if a person have been go through radiant therapy that directed to their chest area, that person is also have a higher chance of getting lung cancer. And now that I already defined the lung cancer and its cause, next I will talk about the symptoms and the treatment. So first for symptoms, as for this specific type of cancer, during the incubation period, there's going to be no symptoms shown unless the cancer itself advanced. So the symptoms for lung cancer after incubation period including chronic coughing, chest pain, shortness of breath, and losing weight without trying. In case that the cancer itself already spread into other body parts and organs, specific symptoms will be shown toward that body parts and organs. For treatment, just as any other type of cancer, for lung cancer there is various treatment including surgery, chemotherapy, and radiant therapy. There is also targeted therapy, which is a new type of treatment but not widely adopted. Depends on age and the health condition and type of cancer. Certain treatment going to be applied for patients. They also can be combined. Now that I talk about the symptoms and treatment, Now we move on to prevention method. So for prevention, the popular and easy way to prevent lung cancer is to not start smoking or quit smoking. So according to the CDC data, 90% of lung cancer death in our nation is caused by smoking. Second is to avoid secondhand smoking and inhaling toxic substances such as asbestos or radon. Have your house checked for radon. It's also suggested by the EPA. And just in case that you did not know if your family have any history with lung cancer or cancer itself actually in incubation period, ask for doctor testing and regular checkup is recommended. Okay, so now that I talk about prevention method, let's wrap it up. Now that you learn more about the lung cancer and know what to do in order to reduce your risk of getting lung cancer, through the point that I presented both. So first, I define lung cancer and the risk factor. Then I talk about the symptoms and the treatment. And lastly, I just mentioned prevention method. Last but not least, I encourage each and every one of you to take a stand against lung cancer because the prevention method are the things that we can do to help this world a safer and healthier place. By promoting non-smoking place, turn your house and car into a non-smoking zone, thinking twice before you smoke and thinking about its consequences. Smoking might give you pleasure for a moment, but in the long run, it will harm the people you love and yourself.